seniors in long-term care have borne the brunt of this pandemic. And I want us to remember how horrible it was. I can't allow us to forget that the military had to be called in. And when the military went into Ontario and Quebec, into long-term care homes, what they saw was so traumatic that it was worse in some cases than what they saw in war-torn communities. We know that our loved ones were neglected, people were dehydrated, seniors were starving, and seniors got bed sores because they were not being treated, were not given enough care. And we know what is the worst thing about all of this is that long-term care providers that were for-profit, like Rivera, were the site of the worst conditions. The most horrific and horrendous conditions happened in for-profit. We heard stories of needles being reused, of prescribed medication that was out of date. This is horrible, and the conditions in Canada were worse than almost every other country that's comparable in the world. And despite it being so bad, to this date, no one's taking action. Justin Trudeau said a lot of nice things about this, but he continues to allow for-profit to continue. We've said really clearly, it is wrong that for-profit exists in this system. That there should be no profit that puts people as a less priority than profits, than money. And Justin Trudeau teamed up with the Conservatives to vote against our motion to remove profit from long-term care. So to give a personal story, I think it's so powerful to hear from someone who can let folks know that they're not alone in this. I want to ask Maureen McDermott to share her story. She's been a very fierce advocate in sharing her story so other folks don't feel alone. And I want Maureen to share her story with you. Maureen, please.
Good morning. Thank you very much, Jagmeet, and thank you for having me here today to speak about long-term care. My mother was Elsie McDermott, and she was born in 1927, and she passed May 21st this year inside for-profit long-term care. She was 93 years old, and I'm in a small town in north part of the GTA, and there's a particular long-term care home there that I had been in before for an event, and I used to drive by there and almost giggle and smirk and think, you know what, at least I don't have to worry because my mom will never, ever be inside of that building or any long-term care. Then life happened. I lost my siblings. There was no other alternatives for home care. There was absolutely no offerings of home care in this province or across this country to keep my mom at home where she deserved to be cared by me. Well, never say never. Life happened and my mother developed Alzheimer's and dementia, and her needs well exceeded anything that I could do for her safely and for what she deserved. So we were literally put into a crisis situation, and guess what room came up first? Right inside that building I drove by and swore I would never go into, and my mom was forced to go in there. At the time, in a crisis situation, you're only thinking of solutions, and that's what I was doing. I was completely naive with regards to for-profit and not-for-profit long-term care. I was actually convinced, as I'm sure a lot of people watching are today, that the paramount importance inside of long-term care is the care, is the residents. And then COVID happened, and we found out very quickly what it was like being inside a for-profit long-term care home. There was lack of PPE inside of this building. It was being reused. It was not being used. It was being turned inside out. So I went to a very prominent person in my community and I did what I had to do, and we found high quality PPE that would save lives, N95 masks, plenty of gowns, gloves, whatever was needed. It was brought to the operator of this for-profit home and it was denied because it was too expensive. It was too much money to pay to keep the staff safe and to keep residents alive. The director of care, the doctor that was in this home, made sure that he worked with other agencies to make sure that there was a critical care plan in place so this never, ever happened again. It was denied because it was too expensive. It was too much money to pay. The doctor does no longer works at this establishment, and as a result of it being too expensive, 36 lives were lost inside of this one home, and I am one story. I am one story out of thousands across this country and across this province. The stories are horrendous. Profits do not belong inside of long-term care, and in fact, profits kill seniors. They are killing our loved ones, your parents, your grandparents, your aunts, your uncles, your brothers, your sisters, and guess what, folks? And it could be our turn. Anybody is susceptible to a stroke and being put into side of long-term care, and I can tell you emphatically, today, putting my mother inside of long-term care for profit was worse than the day that she died, and I'll say it louder for the people in the back. Putting my mother into long-term care was worse than the day that she died. Profits do not belong inside long-term care. Care belongs inside. Thank you very much.
I really want to thank Maureen for those really powerful words. And Maureen's story is sadly not, she's not alone. There are so many people that live this exact experience, who had to make the difficult decision, who wanted to keep their parents and their loved ones at home, but had to because of their care needs. And they thought that they would get the care they needed. And sadly, in for-profit long-term care homes, that's not what happens. Corners are cut to make that profit. Corners are cut when it comes to food and hours of care. And when you cut corners, people lose their lives. That's what we heard from Maureen, and that's exactly what happened. I want to now ask a medical professional, a physician, someone who's an expert in these matters, someone who's an expert when it comes to people at the end of life, someone who has direct experience as a medical professional, as a physician, when it comes to people in long-term care. And Dr. Amit Arya has been a really powerful voice, and he's been someone who's been speaking up. And I really want to ask Dr. Arya to share his experience as a professional, as an expert in this field. Thank you so much, Dr. Arya.
Yeah, thanks so much to everyone for having me today, and thank you to the NDP for inviting me to speak. I'm a palliative care physician who's worked on the front lines of the COVID-19 pandemic, and I've been into long-term care homes with large-scale COVID-19 outbreaks, with over 100 people infected. Of course, these were private for-profit long-term care homes. And to be honest, I'll never forget what I saw. People were abandoned and neglected. People were gasping for air, not even provided oxygen. And people had just been left to die without the basics of medical care, basic hygiene or nutrition. And this was not the fault of the health workers. There were very few health workers left in these long-term care homes, and the ones that remained were actually double and triple shifting, working, maximum hours, stretched to the limit without even proper PPE, and risking their own lives. So I asked myself, after that experience, what is the value of human life in this country, and how could we allow this to happen? Now, meanwhile, while this humanitarian disaster was happening in our long-term care homes and thousands of people were dying en masse, private for-profit long-term care homes and the ownership was continuing to collect millions in shareholder dividends, and in many cases was maintaining or even increasing their shareholder dividends. So maybe we shouldn't be surprised by the numbers. The results here in Ontario speaks for themselves, where the death rate in private for-profit long-term care homes was 5 times higher as compared to municipal homes, and they had 78% more deaths. Now, I'll be honest, myself and my team was deeply traumatized after we went into these long-term care homes to provide support from the local hospital. I myself had nightmares for months thinking about what I saw. But that's also why I'm standing here today, and I'm driven to make this change. And I am thankful to Jagmeet Singh and the NDP for taking this issue head on and actually showing the political will and the commitment to remove profits out of long-term care. I mean, as a physician, this is a critical step to improving the health and safety of my patients that I rely on. Now, I wanted to point out a couple of other things. Firstly, we're standing outside Rivera, and Rivera is especially notorious in my mind because, first of all, out of all private for-profit long-term care operators, they actually have the highest number of deaths in Canada, over 860 deaths across 56 facilities. And secondly, many people might not know this, but they're actually owned by the federal government. I'll say that again. This is a private for-profit long-term care corporation, which is owned by the federal government. It's owned by a federal crown corporation, which actually is the pension fund for public sector employees. And the union, which represents public sector employees, is actually united and are themselves asking their own pension fund to divest from this immoral and unconscionable business. So this absolutely must be one of the first steps to removing profits from care. Finally, I'll just sort of close off by talking about a few things about affordability, because I've heard this a lot where people are asking, well, how can we pay for this? And I want everybody to know about the long-term care funding model, where all long-term care homes are funded or subsidized by the public taxpayer. But why would the taxpayer, or why should the taxpayer, be paying for an inferior standard of care in these private for-profit long-term care homes, who then turn around and try to extract millions for their shareholders? Another point that Maureen made, which I think is so important, is that, and this is something I see in my daily practice when I'm speaking to patients and I'm speaking to their families, is that people, by and large, don't want to end up in these facilities. They don't want to end up in these institutional style sort of warehouses, so to say. They want to age and die at home. That's where people want to be. But unfortunately, because we've underfunded home care, this is often the only option remaining. But if we actually fix that system and put in the funds that were necessary for people to live with dignity at home, we wouldn't need to build more of these expensive for-profit long-term care homes, which, as I said, are bad for the people who live there and bad for us as taxpayers. Finally, I'll just add that this is actually a critical year, 2021, for Canada for many reasons. One of the things I think about is that this is the year when baby boomers turn 75. So I don't think that, our largest age cohort getting older and requiring more care should be used as a business opportunity for these private for-profit long-term care corporations to increase their market share. These companies view human beings as dollars and cents, and we've seen through the pandemic how they've generated millions in profit off human suffering. And I believe and I dream of a long-term care system where we prevent suffering from happening in the first place rather than causing it. Bottom line is that long-term care should be about providing the best care possible for our elders and people with disabilities, and never about the profits.
Thanks so much. We've just heard from Dr. Audia and Maureen McDermott, people who've shared their personal experiences with long-term care. Dr. Arya talked about the trauma as well of going into these long-term care homes and seeing how horrible the conditions were. Donc, ce qu'on a vu sans cette pandémie, ce que frappe fort, ce qui était vraiment une honte nationale, c'est le fait que nos aînés dans les centres de soins de longue durée étaient les plus frappés par cette pandémie. C'est une honte nationale. Et la réalité, c'est, dans cette pandémie, les problèmes qui existent dans les soins de longue durée étaient là depuis longtemps. La COVID-19 a seulement soulevé ces problèmes existants. Et ce qu'on a appris, c'était clairement que les centres de soins de longue durée à but lucratif étaient les endroits où on a vu les pires conditions. Les forces canadiennes étaient envoyées pour aider dans cette situation. Ils ont vu des images traumatiques. Ce sont les mêmes gens qui ont vu des guerres, et ils ont dit que ce qu'ils ont vu dans les soins de longue durée à but lucratif était pire dans plusieurs cas. C'est une honte nationale et on doit agir. On a dit qu'on doit enlever les profits dans les centres de soins de longue durée. Justin Trudeau a travaillé ensemble avec les conservateurs pour voter contre notre motion d'enlever les profits. Ils préfèrent de protéger les profits des ultra-riches au lieu de protéger nos aînés. Nous, les néo-démocrates, nous sommes différents. On veut faire face à cette crise, on veut sauver les vies et on veut mettre fin au centre de soins de longue durée à but lucratif. New Democrats are putting a choice before Canadians. What we've seen in long-term care has been horrible, it's been horrific, it's been traumatic, but we can't accept it. We can't allow it to continue. It can't be that our seniors and our loved ones bore the brunt of this pandemic and then we forget about it. What Maureen and what Dr. Arya are saying is we have to do something to save lives, and we can. Right now, as it stands, when we fund long-term care, some of that money is going to the pockets of shareholders. That is wrong. Canadians don't want our public money going to make people richer. It should be going to protect and care for our loved ones. And that's why we're saying, first and foremost, a new Democrat government would make sure we remove profit from long-term care, starting with Rivera, which Dr. Arya pointed out was one of the worst providers of care, and it is the second largest provider of long-term care homes. We would start there and make it public. We would work with provinces and territories to accelerate making sure there is no more profit-driven delivery of care. We need it to be publicly delivered. And we know the evidence is clear. When it is public, when it is not-for-profit, there are better outcomes. People are better off. We save lives. We want to do that. While Justin Trudeau and the Conservatives don't think that this is a big deal, they don't care about it, they're satisfied with this private delivery of care, we are not. We're going to stand up and fight back and defend the lives of our seniors, those who have sacrificed so much, those who deserve dignity in their retirement, they deserve dignity in their last years of life. We will be there for them, and we are committed to that. Merci beaucoup. Thank you so much. And with that, I'm ready for any questions you might have. Before I go to questions, I want to add one other thing. Justin Trudeau recently made a housing announcement, and I want to say very clearly that after 6 years of Justin Trudeau being Prime Minister, the conditions of housing, the housing crisis has only gotten worse. Housing has become more expensive, renting has become more expensive. Canadians can't afford another 4 years of broken promises from Justin Trudeau on housing. Merci. With that, I'm ready to take any questions you might have.
En français?
Et on finit, je veux dire que Justin Trudeau a annoncé quelque chose sur le logement, la crise du logement. Et on sait que depuis 6 ans qu'il était au pouvoir, la situation s'empirait. Et maintenant, c'est plus cher pour acheter une maison, c'est plus cher pour louer un appartement. Les gens ne peuvent pas aborder qu'attendent de plus de Justin Trudeau qui continue de briser ses promesses dans la crise du logement. And now I'm ready for your questions. Merci.
Thank you. We will go to Tom Perry from CBC News.
Hi, Mr. Singh. Thanks for taking our questions. Thank you to your guests for sharing their stories. You say in your release that New Democrats would remove control from for-profit operators in long-term facilities. Can you tell me who would control them? What system do you envision? Also, according to the Canadian Institute for Health Information, there's about 600 long-term care, for-profit care homes in Canada. What would it cost to take control of those 600 homes?
So first of all, let's talk about our goal. Unequivocally, our goal is to make sure there is no more for-profit delivery of care. There's no question about it. And we know that this is vital. We have to do this. The crisis has shown it really clear. For-profit delivery of care is worse for people. And so we are committed to that. And to do this, we've been up against the same problem in the past. When we brought in universal health care, they were private hospitals. They were very common across Canada. We had to use the Canada Health Act to make sure that care did not continue to remain private, and we wanted to make it public. Similarly, we provide funding, and that funding should go towards the best quality of care, should go towards staffing, should not go towards profits. We can figure out a way to make sure this is better, using the Canada Health Act the same way we did when we tackled private hospitals. The question here is, are we okay with the way things are? Are we okay with the deaths of our loved ones and seniors? Are we okay with the status quo? I, for one, am absolutely not okay with it. We need to do better, and New Democrats are committed to making it better.
But do you see a national system? Do you see the federal government stepping in? Do you see the provinces stepping in? If the private company is not going to run this, who will? And again, I have to ask you, how much is it going to cost to take control of 600 long-term care facilities?
One, we can't afford not to act. If we don't do anything, we're going to see hundreds of seniors die. That's not a price I'm willing to pay. So I can tell you that right now. I'm not going to pay the price of hundreds of seniors dying because they're neglected, because they're starved, because they're not being fed, because they're not getting water, because they're dehydrated. That's a price I'm not willing to pay. We can do this. And what we'll do is a number of things. First off, there's not-for-profit models of care. They are shown to work. There's public models of care. They work. We are funding this care anyways. We are funding this care. Wouldn't it make sense when we fund this care to make sure that care is only publicly delivered or that care is not profit driven? We can do this. If we fund this care anyways, if we're contributing to this care, we want all those dollars, every single dollar that we spend as a federal government, as provincial and municipal governments, I want every single cent of money that we spend going directly to care. In fact, it is less costly if our money is going towards care than if it's going towards care plus profit. We want it to all go towards care. There are ways to deliver this care. We know that it works. We know that not-for-profit models work. We know that municipal profit models work. We know that public delivery works. That's what we're focused on, and we want to make it happen.
Next question, we have Creason Ajikte from CTV News.
Hi, Mr. Singh. Thanks for taking my question. Thanks for the guests for giving their stories as well. So, Mr. Singh, you also said you would implement a care guarantee to guarantee residents that they receive safe, dignified care, and you would put a ban on the development of any new for-profit care homes. How exactly would you be able to do that? What types of things can you do if you were to become the next leader?
Well, with the care guarantee, what we've seen in this pandemic is the outcomes or what happened wasn't the same in every province. The military were called into Ontario and Quebec, but there were other provinces that had less of outbreaks or had better care. So let's look at what the best practices are. What is the best possible way to take care of people? We know one of the things that has come out very clearly is hours of care. If you have more hours of care, we know that seniors are healthier, are better cared for. It seems pretty obvious, but that is something that has been very clear. When hours of care are low, when staffing levels are low, then the seniors are more at risk. They're more likely to get sick. They're more likely to die. So let's put in place, what does a care guarantee look like? What is the best possible care when it comes to residents? What is the best possible care when it comes to hours of care and the staffing levels and who those staff are? The number of hours of nurses, of physicians, of personal support workers. Let's establish what the best practices are so we can set standards that this is what good care looks like. This is what we should be striving towards. And in terms of how we achieve this and how we bring about this change, it's going to take working together. It's not easy. I'm not claiming it's going to be easy, but I know that it's essential. I know that we have to do it. And so we can look at what we've done in the past. We have tackled the same question about private care in our own past. In Canada, there were private hospitals. There was private delivery of care, and we fought against that. And collectively, we solved that problem. I believe we can do it again, and I believe we need to do it again. And our seniors and their lives are at stake here. And to me, the odds are not, the stakes are so high that we have to get this right.
Next question, we have David Aiken from Global News.
Hi, good morning, Mr. Singh. Good to see you. Thank you to your guests as well. Just let me push back a little bit on this idea. We certainly know that there was a clearly documented problem that was specific to for-profit healthcare, long-term care homes, no question. But we have examples, let's say the airline industry. We don't have planes crashing in the sky. For-profit airlines are running around because the federal government is very strict. There's very strict standards. There's high penalties. We have a new passenger bill of rights. Why wouldn't the path of easiest resistance be national standards for all long-term care homes, minimum staffing ratios, pandemic preparedness plans, constant and frequent inspections? Wouldn't that be the path of least resistance to best protect people in long-term care homes?
I don't think it's an either or. I think we absolutely need to make sure that there's good standards of care. There's no question about that. And there needs to be good mechanisms to make sure that that care is actually happening. So there's no question about it. We need enforcement of those standards. We need accountability, no question about it. But really what it comes down to, and what to me is a really compelling argument, is that we are spending our public money, taxpayer dollars, on the care of our loved ones, of seniors. Why would we allow even a cent of our public hard-earned dollars, taxpayer dollars, why would we allow even a cent of that to go towards lucrative for-profit companies like Rivera. These are wealthy corporations. These are large, profitable corporations. Why should we allow even a cent of our dollars to go towards their profits instead of the care of our loved ones? That's the problem. And when it comes to care, if we're on an airline and the food's not so good, it's only a couple hours flight. If you're living in a long-term care home and the food's not so good, it means you get malnourished and you die. It's a very different scenario. And so when it comes to care, to me, we need to have the best quality care. And it's not just about standards, it's about the goal. The goal of a for-profit home is not to care for people, it's to make profit. And anytime when you're talking about caring about vulnerable people, if the goal is profit, corners are going to be cut and people are going to suffer. And that to me is just not on.
I'm going to change topics for the next one. The Liberal leader today took note of your campaign. Of course, not in a good way. This happens time to time in election campaigns. I think you saw it last time, that the Liberals are going to try to scare some people who might be considering voting New Democrat by warning them that a vote for a New Democrat is a vote for Aaron O'Toole to become PM. And I wonder if you've got a particular answer to that one this time around.
Well, I mean, I just look at, we're talking about long-term care homes today. There is no difference between the Conservatives and the Liberals on this question, because they both teamed up to vote against removing long-term care home profit from long-term care homes. Put another way, they both voted in favor of private long-term care homes. They're both okay with private care. That to me means that they're not going to make things better. If your loved one and you're worried about your loved one being in a long-term care home, and your question is, well, who do I vote for in this election? Who's going to protect my loved one? Who's going to protect my family? Who's going to make sure they get the best care possible? Well, it's clear. Both the Liberals, Justin Trudeau, and the Conservatives believe in for-profit care. We're the only ones saying it should not be for-profit. It should be not-for-profit. It should be people first. It should be our loved ones first. They deserve dignity and respect. That's one question. Whether it's housing, which is another issue that Justin Trudeau is talking about today. Well, under Justin Trudeau being Prime Minister, the housing condition has gotten worse in 6 years. What makes people believe all of a sudden he woke up today and decided, okay, I made the housing condition worse for 6 years, but now I'm going to somehow make it better? He had 6 years to deal with this. If he cared about it, wouldn't the housing crisis not be here? He had 6 years. He's asking for a 4-year mandate. He just had 6 years. And he couldn't get it right in 6 years. What makes people believe he's going to get it right in the next 4 years? To me, it shows that he loves to do the classic Liberal strategy. Why deliver on something when I can just promise it in an election? And that's what I see Liberals doing often. And that's why I would say to Canadians, let's vote differently then. Why do we need to go with the same parties that keep on making it harder for your lives?
En français, s'il te plaît?
Ça va être difficile en français. Justin Trudeau parle souvent de ce qu'il va faire maintenant dans cette élection. Et c'est intéressant parce qu'il a eu 6 ans pour montrer ce qu'il peut faire. Si on parle de cette question des soins de longue durée, il appuie la position de conservateur que les soins de longue durée, les centres des soins de longue durée, à but lucratif, sont d'accord, sont acceptables. Pour nous, notre position est différente. On dit non, clairement, on ne doit pas avoir les profits dans les soins de longue durée, dans les centres de longue durée. Donc notre position est différente et les conservateurs et les libéraux ont la même position qui appuie les services privés. Quand on parle de la crise du logement, si Justin Trudeau a voulu faire quelque chose, il a eu 6 ans de faire quelque chose de nouveau. Et dans ces 6 ans, au lieu d'améliorer la situation s'est empirée. C'est plus cher maintenant d'acheter une maison, c'est plus cher de louer un appartement. Donc, comment les gens peuvent croire en Justin Trudeau quand il a eu 6 ans pour régler les mêmes problèmes qu'il dit maintenant, je vais régler? Je dis aux Canadiens, vous avez un choix dans cette élection. Les néo-démocrates priorisent vous et vos familles. On est prêt de se battre contre les ultra-riches pour qu'ils puissent payer le juste part pour investir dans les gens. C'est notre priorité. On va se battre pour vous.
Next question, we have Annie Bergeron-Oliver from CTV News.
Hi there. I have a clarification and a question, so it's going to be a bit of a two-parter.
Sure, yeah.
First, I just want to clarify. So are you saying an NDP government would nationalize all the 600 roughly for-profit care homes in Canada? And the second part is, Both of the speakers today talked about the fact that there's not enough home care for people, that there aren't enough options available, which is pushing them into long-term care homes, which a lot of seniors and elderly don't want to be in. So what specifically would an NDP government do to help with home care and to ensure that seniors who don't want to go into long-term care homes can actually stay in their own homes?
I appreciate the question. I'll start with the long-term care homes. We are saying clearly that we would nationalize Revera. It is owned by it's owned right now by a federal agency. It's completely wholly owned by a federal agency, and we say clearly we need to get profit out of long-term care, starting with Revera, which is completely owned by the federal government. That is wrong. It should be public. It should not be for profit. And when it comes to the rest of the long-term care homes, we want to use the same tools that we used with the Canada Health Act to ensure that our dollars that go towards the care of our loved ones go towards their care and don't go towards enriching a company. And so we will use that same model to make sure that we use every resource possible to push the delivery of care to public delivery, not for-profit delivery. And then with the home care question, it's so true, and I should have touched on this earlier, that we need to have better investments in home care. There is no question that the best place for people to age is in their home. But as Maureen pointed out, there is not sufficient home care available to give people the care they need to stay at home. And so if we made more investments in home care, we could provide that type of support that would allow more people to stay in their homes. And that's where they want to stay. And so absolutely a part of the solution when we tackle the problem and the crisis in long-term care is to make more investments in quality home care that should also be publicly delivered to make sure people get the care they need to stay at home. And then if there is a point where people need a long-term care facility, it shouldn't be a death sentence. It shouldn't be something that someone is afraid of. It shouldn't be something that someone dreads. In the case of Maureen, she dreaded that decision. It was one of the hardest decisions of her life. She said clearly, and a lot of people share this, it was worse than actually losing her mom, to know that she'd have to go somewhere where she wasn't sure if they were going to get good care. Imagine how that feels. Imagine how that choice feels for so many people. And so many people are forced into that decision because of a crisis, because they can't provide the level of care that someone needs that goes through a crisis, whether it's a stroke or whether it's Alzheimer's. They get to a point where they need that extra level of care. It shouldn't be something that someone dreads. There should be a care guarantee where people know that someone's getting the care that they need.
And on a separate subject, the Conservative leader made an announcement on protecting pensions, and just yesterday, another announcement targeted towards workers. In a press release today, the NDP called this announcement, quote, not worth the glossy paper it's written on. Can you elaborate?
Well, it's really clear, the Conservatives have shown again and again, they're no friend of workers. When Aaron O'Toole was in the cabinet under Harper, we saw the attacks on workers. We saw the back-to-work legislation. We saw the attacks on the rights of workers, and he didn't make life better for workers. And right now, what are workers calling for? I've spoken to so many workers in precarious jobs, workers that have a good job but doesn't have benefits. They say, we want to have medication coverage. And Aaron O'Toole teamed up with Justin Trudeau to vote against pharmacare. We know that workers want to make sure that their teeth are cared for, and they voted against that as well. It's clear that Aaron O'Toole is no friend of workers. It's clear that he is a friend of the ultra-rich. When we said we should make the ultra-rich start paying their fair share, we should make companies like Amazon pay their fair share. Amazon is a company that has made record profits in this pandemic. Instead of agreeing, he said, no, we are against that. He voted against that, as did Justin Trudeau, showing that he'd rather the burden fall on workers. So he's no friend of workers. He can make announcement all he wants, but his track record and his current positions show he is not a friend of workers.
En français, s'il te plaît.
Aaron O'Toole peut dire ce qu'il veut, mais on a son bilan. Il était ministre dans le gouvernement de Harper, et Harper a coupé les dos aux travailleurs et travailleuses. Et il a rendu la vie plus difficile pour les travailleurs et travailleuses. C'est clair que les positions de Aaron O'Toole sont contre les volontés des travailleurs et travailleuses. Et quand on a dit que ça doit être les autres riches qui paient le juste part pour investir dans les gens. Ça doit être les compagnies comme Amazon qui gagnent des profits records qui doivent payer le juste part. Aaron O'Toole a travaillé ensemble avec Justin Trudeau pour voter contre cette motion. Et effectivement, il a dit qu'il veut que la pression tombe sur les épaules des travailleurs et travailleuses. Donc c'est clair qu'il n'est pas un ami des travailleurs et travailleuses. Il peut dire ce qu'il veut, mais son bilan, ses propos sont clairs.
Prochaine question, Jean-Sébastien Cloutier de Radio-Canada.
Monsieur Singh, pour enchaîner sur les conservateurs, il y a quelques jours, ils ont fait une annonce dans la lutte contre les opioïdes. Aujourd'hui, ils font une annonce pour protéger justement les pensions des travailleurs. Vous dites quoi de cette incursion à gauche des conservateurs dans une circonscription comme Hamilton où vous allez cet après-midi? Ça vous fait pas peur un petit peu que les gens pourraient être tentés d'essayer autre chose?
Non, pas du tout, parce que le bilan des conservateurs, c'est clair. Ils ne se battent pas pour les gens. C'est clair avec les bilans de l'ancien gouvernement conservateur où Erna Toulette, une ministre, c'est clair, leurs propos, leur position n'est pas en faveur ou pour l'avantage des travailleurs et travailleuses. Ils ont clairement voté contre notre motion qui dit qu'on doit faire payer le juste part des ultra riches. Au lieu de faire ça, Erna Toul a voulu protéger les intérêts des ultra riches. Donc c'est clair, il n'est pas un allié des travailleurs et travailleuses et on peut clairement montrer comment nous sommes un parti des travailleurs, nous sommes un parti des gens, nous sommes un parti qui toujours priorise les besoins des gens.
Et sur l'annonce d'aujourd'hui, comment feriez-vous pour imposer des normes canadiennes pour les soins longue durée? Est-ce que, d'après vous, par ailleurs, ça peut s'appliquer au CHSLD au Québec, par exemple?
Ce que je veux faire, c'est de présenter c'est quoi les meilleures pratiques. On sait qu'il y a des pratiques à travers le pays qui ont fonctionné dans cette pandémie et on sait qu'il y a des pratiques qui étaient horribles dans cette pandémie. Pourquoi pas rassembler ces pratiques et présenter c'est quoi une bonne qualité de soins? Pourquoi pas montrer c'est quoi les pratiques qui fonctionnent ensemble? Et voilà, ce sont les garanties que vous devez avoir. Ce sont les critères pour une bonne qualité de soins. Je pense que c'est quelque chose d'important. Et aussi, on a vu les médecins au Québec ont demandé les mêmes choses. C'est important d'avoir ce rassemblement de toutes les pratiques qui sont bonnes pour les gens, qui vont aider les gens, qui vont aider nos aînés. Et on reconnaît le droit de retraite avec plein compensation du Québec. Mais ce qu'on parle aujourd'hui, c'est comment on peut aider les gens, comment on peut travailler ensemble pour améliorer la situation. Les forces canadiennes ont dû être envoyées au Québec aussi. Donc au Québec, la situation était terrible. Donc on veut aider les gens, on veut protéger nos aînés et on peut le faire.
Next question, Liam Casey from the Canadian Press.
Morning, Mr. Singh.
Hey there.
Elections Canada won't open on-campus polling stations in this election. Are you concerned it could affect your youth turnout, parties' winning chances in certain ridings?
I just kind of missed a bit of it. Can you step closer to the mic,
Sorry.
maybe?
Elections Canada says they won't open polling stations on campuses.
Okay.
Wondering if you're concerned that it'll affect youth turnout in general and potentially winning certain ridings.
Yeah, I want to make sure that voting is as easy as possible, and I wanted to see voting happen on campuses. Though a lot of campuses have been closed or have had online courses, a lot of students still live close to a campus. That's still a place for them to, it's still easy for students to access. They know where to go, and it would be easier. And anytime it's easier, it encourages more participation. So for me, really the question is, how do we get as many people possible to get out and vote? We want to encourage voting, make it easier to vote. We want people to participate, and to do that, this would be one tool. Having on-campus voting has been shown to help encourage more participation, and for me, that's a priority always.
Thank you. On long-term care, how will you convince provinces to move away from the for-profit model?
This is the challenge. It's not going to be easy, and I don't want to ever suggest it's going to be easy, but it is essential. It is something we have to do. We have to get profit out of long-term care because the evidence is so overwhelming. There's no denying the facts, and there's no doubt that for-profit care is worse for our seniors. It means they get less quality care, and it means they're more likely to get sick and to die. That to me is more than enough. That is more than enough to convince people. Shouldn't we want to save people? Shouldn't we want to save our loved ones and our seniors? And so we'll use all the tools we have to work together with provinces. This is not different from when we wanted to bring in universal health care. It started by Tommy Douglas in Saskatchewan, And then we wanted to bring that idea to the national stage. And there were some provinces that didn't agree. And now it's one of our most cherished national programs. The fact that we've got, or one of our most cherished national identity, that we've got universal healthcare for all. The same way that we made that happen, we need to make it happen in long-term care. It cannot be that long-term care is not a part of our universal healthcare system. It can't be that for-profit continues. And I'm committed to doing whatever I can to achieving the reality of a publicly delivered, a not-for-profit model when it comes to long-term care.
Next question, we have Natasha O'Neill from The Pointer.
Hi, Mr. Singh. It's no secret that Peel has been hit really hard with the pandemic. And many of the findings that you were speaking about that the military found were actually here in Peel. I know that you're a national leader, but how are you going to advocate for Peel, who continues to get left out of a lot of policies and a lot of funding?
I really appreciate the question. It is so sad how Peel is a community of frontline workers, of workers in logistics, of workers that helped keep Canada going when we were in this pandemic. The food that we ate, the goods that we needed, it was here in Peel that a lot of that work was done. A great deal of that work was done here, and because the workers here were on the front lines, this is a community that was one of the hardest hit, with high rates of COVID-19. This is a community that also saw some of the horrible conditions we spoke about in long-term care happen here in Peel as well. And so when I advocate for getting profit out of long-term care, I know the communities that are hardest hits will be the communities that will get help the most. And so that's one of the things that I've been advocating for. When we talked about paid sick leave was one of the things that experts had said was one of the most important tools to save lives. And we knew that would directly impact people in Peel who have to go to work, had to go in person to work, couldn't work from home because of the nature of their jobs in transportation or logistics, in warehouses. They had to go to work in person, and because they didn't have paid sick leave, would go to work sick. And we saw workplace transmission was one of the highest causes of sickness or the highest rates of infection happen in workplaces. We can fix that by bringing in these programs. So when we talk about making sure there's good paid sick leave, when we talk about getting profit out of long-term care, that will directly help people here in Peel because they were the hardest hit.
Your campaign focuses a lot on the youth vote, but it's also important to acknowledge there are older generations that are also voting. Many of these older generations, in Ontario especially, remember the NDP government of the 90s, Bob Rae, and a lot of them were really unhappy with this government. Are you any different from this government, and what can you tell these older generations who may be on the fence of voting for you because of the past?
Well, Bob Rae became the leader of the Liberal Party, so I think that kind of gives a sense of where his values were. But more importantly, we have seen what New Democrats have done. We have seen Andrew Horwath here in Ontario fighting every step of the way for workers, for personal support workers, for frontline care, and for people. We've seen the track record. At the federal level, folks have seen New Democrats fight for them to bring in more CERB. We doubled the amount of CERB that people got. We increased the wage subsidy, and in doing that, we saved millions of jobs. We helped millions of people stay in their homes when they needed to and helped keep food on the table. We fought to bring in a federal paid sick leave that helped hundreds of thousands of people, and we brought in support for students who were not covered by CERB. We have shown really clearly what you get when you vote for New Democrats. You get someone that's on your side, that's focused on you. We've also seen what you get with Liberals. The Liberals wanted to do the minimum. They started off the wage subsidy at 10%, which was not going to save enough jobs. We know what you get with Justin Trudeau, someone who believes in for-profit long-term care homes, something we don't believe in. So you have a choice here in this election. Absolutely. We've seen the Liberals and what they've done. They made the housing crisis worse. They believe in for-profit long-term care homes. They don't believe in pharmacare. Or you can choose New Democrats who believe that the ultra-rich should pay their fair share. We should invest in our housing crisis. We should invest in healthcare. We should get profits out of long-term care. People have a choice, and we've shown them what we stand for and what the Liberals stand for.
That concludes our press conference. Cela conclut notre conférence de presse. Merci. Thank you.
Merci. Thanks so much, everyone. Merci.